Hi, it's Jennifer here at Indiana State University studying for my BSN. And the population at risk that we're talking about today is the adult population. And we're going to discuss some wellness tips to keep us safe and healthy. And the learning objectives for today is to know exactly what it is that we need to do to live the best life that we can live. This is a picture of MyPlate from choosemyplate.gov. This is the current recommendations. The food pyramid that was once used is no longer recommended, and this is what's recommended now. It's 2 cups of fruit on our plate, 2.5 cups of vegetables, 6 ounces of grains, 5.5 ounces of protein, and 3 cups of dairy. So this picture here is an ideal photo of what our plate should look like, because most of us Americans, we consume the wrong foods in the wrong portions. And please keep in mind that when we're cooking, the good oils to use are olive and canola oil, and healthy sugars to use are monk fruit, agave, and stevia. The artificial sweeteners that many Americans use really aren't good for us and contain a lot of chemicals. Exercise. To some people, this is a bad word. They just really don't care to exercise. But if they would find that exercise promotes endorphins. And this creates sort of a natural high that can combat depression. It can help maintain a healthy weight, which is going to make us more joyful and happy about the way we look in the mirror. It helps us control blood sugar and also control blood pressure. It's recommended for a total of 150 hours per week. I know that sounds like a lot, but it can be broke down throughout the week, and it is recommended that both aerobic and strength training exercises are put into place. Maintaining a healthy weight is a very important part of being a healthy adult, because as we age, our metabolism normally slows down. It's just how nature works. So it's important that we keep our BMI in normal range, and so that's between 18.5 and 24.9. And remember, our BMI is calculated according to what our weight and our height is. For more information on that, there are BMI calculators online and many resources to look up on BMI. Limiting alcohol intake is very important for a healthy adult, because many Americans, we just consume a little too much. 1 drink per day for women is what is recommended, or 2 drinks per day for men. Anything over this is actually considered more than moderate alcohol consumption. So sometimes people need a little bit of help, a little bit of counseling in order to back down on the alcohol intake. But unfortunately, alcohol damages the liver. It can also damage the heart. So if we want to live a healthy adult life, limiting our alcohol is very important. Try to stop smoking. I know that this is easier said than done, but there are ways to stop. There's the quit hotline. You can talk to your doctor, and it is doable. The average cost of cigarettes is $6.28 per pack. That's $188 per month, $2,292 per year. And my goodness, that's over $22,000 in 10 years. We could really do a lot with that money besides just smoke it. So I really encourage you to stop smoking. Smoking also adds to costs of medical care, the average medical care for a smoker in their lifetime is $1 million. Sun exposure. Now this is very important to keep into balance. Our body does need sunlight because it makes vitamin D, and without the proper vitamin D, that can cause depression, osteoporosis, cancer, and muscle weakness. However, if we get too much sunlight, then that poses a cancer risk. So the recommendations now are between 10 and 30 minutes of sunlight per day. Now, of course, this is going to go according to the season as well. In the hot summer sun, you might want to limit it to just 10 minutes, but in the winter sun, 30 minutes. Regular exams are very important to stay healthy. It's recommended that your teeth are cleaned at least twice a year. There are some people who have a tendency to build more plaque, and for them it's recommended every 3 months, but at least twice a year. An annual eye exam is recommended yearly, along with an annual physical exam with your primary care doctor. It's important to also schedule the cancer screenings at the appropriate age. A pap smear for women usually starts at 25. A mammogram for women usually starts at 40. And the prostate check for men at age 50. The colonoscopy at age 50. And the lung cancer screening at age 55. Now that may come sooner if you're a heavy smoker. Being vaccinated is also a very important part of being a healthy adult. It's important that we get our flu vaccination yearly because that's the length of time that the flu vaccination lasts. But the tetanus, the diphtheria, and the pertussis, they last quite a bit longer. It's recommended that we get those every 10 years. Now, if you do step on a rusty nail or cut your finger or something like that, the doctor may recommend a tetanus shot by itself a little bit sooner, but on a regular basis, it is every 10 years. It's also recommended that adults age 59 and over receive the shingles vaccination because the shingles in adult life is a very uncomfortable situation to be in. So it's ideal just to try to prevent it altogether. The pneumonia vaccination is recommended for age 65 and older. Thank you so much for listening today. And again, I do encourage you to do research because the recommendations and the trends are ever changing in medicine. So have a good day and stay safe.